Welcome to another episode of The Granite List Live, where we explore all things human capital and benefits related. Today, we are joined by Dr. David Adamson, who is the founder and CEO of ARC Fertility, and Dr. Eliza Chin, who is the executive director of AMWA. And I am so excited to have both of you here, especially because the timing is impeccable. SHRM, the Society for Human Resource Managers, just released results from their survey on employer ratings of benefits importance. And there's a long list of things that employers find important, but in the top 5, employers rated family-forming benefits as one of the most important benefits that they should be focusing on. It's at a 67% rate of importance in the benefits category. So this is a huge hot topic. I know having Dr. Chin on, we are also going to look specifically at how family-forming benefits and fertility issues impact women in the workforce. Dr. Adamson, I'm going to let you open up a little bit by talking about the rise of infertility.
Thanks very much, Sally. It's great to be here today talking about a topic which is getting increasing interest. And I just would like to emphasize that when we use the term women throughout this, we want everybody to know we're being very inclusive and really including all those who identify with their gender and want to be inclusive and respectful of everyone. For simplicity of our conversation, we'll include everyone. Infertility certainly seems to be getting a lot more attention these days. It's quite interesting on a global basis. It's not clear how much actual causes of infertility per se have increased, but what's happened because of a lot of social changes, in particular all over the world, with women having babies later for mostly really good reasons, more opportunities in education and the workforce, that they're delaying having children. And of course, when they delay having children, that means that more people are going to have some difficulties getting pregnant, not just because they're older, but because other gynecologic diseases over time tend to occur more often as people get older. And so there certainly is, on an age-adjusted basis, probably not too much difference. But when you take into account that babies are being born later, there is a real increase in the amount of infertility. And secondly, in our country and in many, many other countries, there's a much increased recognition that infertility can include everyone, including singles, those in the LGBTQ plus community, and those who identify with gender different than their biology at birth. Because of this, we recognize there's so many new ways to form families and wonderful ways that people can form families. And because of these sort of social changes, and also in the media, much more attention being paid to infertility, there is a lot more awareness, and there's a lot more need for us to have the conversation around infertility, not just in society generally, but certainly in the workplace, because women are now taking a much more significant role in the workplace because they're getting more opportunities, which is obviously wonderful.
And Dr. Chin, on the heels of that, tell the audience a little bit about the work that AMWA does.
Thank you so much. And again, it's such an honor to be here representing the American Medical Women's Association. This is an issue that's very near and dear to our heart. Data has come out over the past few years about the much higher prevalence of infertility among women physicians. Data has suggested estimates of about 1 in 4 women will experience infertility. And there's even some more recent studies showing that that number might be even higher as we learn more. AMWA took this on as an issue that we wanted to champion when we saw the data and realized it was impacting a huge percent of our members. And I think since that time, and also just globally, people are talking more about it. Globally, it's 1 in 6 individuals will experience infertility and 1 in 4 women physicians. So I think women physicians are starting to speak up. We see articles in the New York Times, in Time Magazine, on social media, and raising awareness of this issue so that women can be more informed about some of the decisions that they make. Even with all of that, we're finding that because of this intersection of basically the career trajectory of physicians and the timing of fertility, often it's at early career stages where there's a significant impact on decisions that people need to make. And a recent study from JAMA showed that 3/4 of women physicians delayed childbearing because of their career. And at least in that study showed that more than 1/3 were experiencing infertility. So it's a very important issue for us as an organization.
You are right. You're kind of the double-edged sword, because not only do you have an organization of physicians that are helping treat many times this issue, but also as child bearers themselves dealing with the issue. So I'd love to ask the two of you, let's kind of start the conversation by looking at what you think the biggest misperceptions are about fertility.
Well, Sally, I'd like to start by saying that I think one of the biggest problems is that infertility is considered just a woman's disease or problem, and this is absolutely not true. Men are biologically the direct cause of infertility 25% of the time, and additionally, another 1/4 of the time, they are contributing biologically to the problem. So half the time, the infertility is not just a woman's problem. It's biologically involves the man. And this is very important for a couple of reasons. One, they need to get help to try to overcome the infertility. But two, they need to really be very involved on an emotional basis, helping their spouse. And it also needs to be recognized that they have emotional issues around this, especially when they're directly involved. So it's important to recognize the biology and the emotional component of men being involved, the importance of being involved. And frankly, on a societal basis, it's very important because while women clearly bear far and away the greatest reproductive burden in our society, if we're going to really bring about equity in terms of access to care and care in maternity and paternity and taking care of kids, it's important that the men become involved and support women. They're carrying a bigger biologic burden. It's important for men to be prepared and understand it's only equitable for them to carry a bigger sociologic burden, whether that means by time at work or helping out at home and doing their share at home and what have you. Men need to become more involved in reproduction. So I think that's a very important aspect of infertility. This is not just a woman's problem. The second thing is that infertility care is not nearly as expensive as most people think. Certainly some of the technologies cost a lot of money now and they're not affordable because they're not covered. But many, many aspects of fertility care can be managed with simple information, doing the right thing, preventing infertility. And when care is needed, often the treatments are not that expensive. So I think that's a major misperception that everything's expensive, and it's not true. And the final comment I'd make is, and it's important because we're talking about the workplace and employers, is that it's absolutely clear that by having family-forming benefits, first of all, they don't cost that much to put in. 97% of employers in a Mercer study said that it did not increase their healthcare costs much at all by having family-forming benefits. But secondly, that there are real cost savings from family-forming benefits. In particular, cost-effective evidence-based care lowers waste. And secondly, you can reduce the risk of multiple pregnancy and associated maternity complication costs and neonatal intensive care unit or NICU costs for babies. And so it's not that expensive and you can save a lot of money. So there are real misperceptions that are gradually being overcome, and it's important for people to recognize these.
I think those are such good points that you raised, Dr. Adamson. And one thing is just even our personal bias and perspectives, because I think subconsciously people always feel like this is not very common. But if you, again, look at the statistics from the WHO, from the studies, 1 in 6 globally, this is common. And when you have a common issue or a common challenge, then really the important piece is how do you make sure that access to medical care and treatment for that is accessible to everybody? And that's why I'm so glad you're doing this podcast and we're talking about employers and what employers can do. This is I think, a really key part of the solution of addressing a very common problem. Also, by incorporating family-forming benefits into insurance coverage and employer coverage is the fact that it will help bring about equity. There are a lot of underrepresented groups like the LGBTQ plus community where family planning will inevitably involve some need of intersection with fertility care. Also, there are many social determinants of health that impact infertility. And again, offering family-forming benefits helps bring about equity and access to a large group of people who might not otherwise be able to access this care.
Absolutely. We've explored the misperceptions around fertility itself. I'd love to ask you both, what is the importance or significance of family-forming benefits today?
Well, that's a great question. Thank you for asking that. I really feel like family forming benefits is a game changer, mostly because of the issue of cost. And within medicine and within AMWO, we talk about the fact that often our new physicians are graduating with a huge amount of personal debt related to medical school tuition. And at the same time, they may be then considering this different stage of life where they are looking at family planning and, again, not having enough income to both support paying off medical school loans and starting perhaps fertility treatment. And so the ability to have access to family forming benefits is really a game changer for many individuals for so many reasons. And again, for this very, very common problem. It also helps provide equity and inclusion for those who otherwise wouldn't be able to access family planning. Underrepresented groups like the LGBTQ plus community will necessarily need to interface with fertility care when they want to start building their families. Also, infertility is impacted by so many of the social determinants of health. By, again, providing family forming benefits, you essentially will help bring equity to a group of individuals who may not have been able to access that in the first place.
Yeah, I think that's all really, really important. And one of the other things is that employers probably don't really recognize is that even if they don't have family forming benefits, they're almost certainly paying some money for family forming care. And the reason for that is that when there aren't benefits, employees, and it's generally women, but not always, goes to their doctor. And if it's an OBGYN, they will often provide fertility care, such as oral fertility stimulation drugs and intrauterine insemination. And then they'll miscode that in the general medical plan with a diagnosis that the employee really has, like fibroids or endometriosis or pelvic pain, but it's not actually the diagnosis that's being treated at the time. And there are studies out there that show that up to 40% of the cost of appropriate care can be provided this way in the general medical plan. And the employer is paying that money, doesn't even know they're paying it. And it can be even more complicated because the care is often not the right care for the patient because they're just doing what they can get covered in that plan. And it may be provided by someone who's not really expert at it. So it certainly may not be given in the most appropriate way. And also, it can have a higher risk of ending up with a multiple pregnancy because people are, frantic to get pregnant. And so they can end up with a twin pregnancy and all the associated costs with that, which, of course, then end up getting paid in the general medical plan. So there's definitely evidence that even if there aren't family forming benefits, there can be real cost associated for the employer with not getting the care you need and still paying for it. So that's why family forming benefits can be so important just from a cost point of view as well for the employer.
Mm-hmm. And Dr. Adamson, you've mentioned the general medical plan a couple of times. So that leads me to ask the question, would it be important and why would it be important to have fertility benefits in addition to the general medical plan?
So the general medical plan certainly in many cases provides general medical care, but because of limitations in the Affordable Care Act or Obamacare, which restricts treatment to specific diagnoses, infertility with specific definitions, any care provided in the general medical plan, the first problem is it's not inclusive because it's not possible usually to include women who, for example, need to freeze their eggs before cancer treatment, or the same thing for men before cancer treatment to freeze sperm. And it's not able to help people in the LGBTQ plus community because of restrictions on the type of care. And certainly those who need surrogacy won't be included, and those who need adoption, it won't be included. So the bottom line is that care provided through the general medical plan, simply because of the way the ACA is structured, cannot be inclusive and cannot be comprehensive. So that's the first real problem with maintaining the care in the general medical plan. The second problem is that care in the general medical plan is not really being managed. There's excellent evidence that the highest quality fertility care comes from specialists in fertility that are providing that care in a managed fashion, and not managed in like something where everybody gets the same thing, but managed where really good providers, good physicians and healthcare providers do the right thing for that person on an individualized specific plan based on what that person's problems are, and obviously what that person's goals are for family forming and what options are acceptable to them. Is donor egg acceptable, or donor sperm, or surrogacy, or is it okay to do in vitro fertilization or not? So you need to get a specific plan for that person with an expert providing it so you can manage the care. And the evidence is clear that when you do this, you not only get better outcomes with higher pregnancy rates and live birth rates, but you get fewer complications such as twins or multiple births, which can cost a lot of money. And the care is way more cost effective. You're not wasting money in the provision of care. And so you end up avoiding waste, getting better outcomes, lowering complications, and you're providing inclusive, comprehensive care. So it's really clear that it's better to provide family forming benefits through, if you will, a carve out from the general medical plan. And it can be coordinated with it so people get everything they need up to the diagnosis of infertility in the general medical plan, but then they move over to a really high quality care that's going to help them get the family they want. And it saves the employer money, and the employees are happier and get better outcomes.
Okay, so you've convinced me it's the right thing to do for a variety of reasons, but I want to double down on that last part. And I want to ask you, Dr. Adamson, what is the return on investment for an employer who implements a family forming benefit program?
We can really show that if an employer put in a subsidy of even $10,000 a year for an employee who needed fertility care, they would basically break even in that the money they saved on not having miscoding, having efficient care in the system, not having twins, not having the costs of complicated pregnancies or NICU costs, that a $10,000 subsidy amount to any given individual who needed that much, some wouldn't need anywhere near that much, but somebody would basically be a break even. The average subsidy now that employers are putting forward for family forming benefits is about $20,000 or $25,000 if and when an employee uses it. And while clearly it depends on the demographics of the population of employees and members, the expected utilization rate is about 1% of members would use the benefit each year. So there are ways to calculate what the cost is going to be and exactly what the savings are going to be. But if you go and provide evidence-based care, high-quality care in this situation, you can basically break even at a $10,000 subsidy and pay well under $100 for your average member for a year to have terrific benefit for your employees.
Perfect. And Dr. Chin, you've talked a great deal about the impact that this disease state has in impacting the workplace. So can you talk to us a little bit about what the value on investment would be for an employer who implements family forming benefits?
Absolutely. So studies have shown that women with infertility have the same anxiety and depression levels as women with cancer, heart disease, HIV, and even worse, often people bear their infertility journeys alone. So the fact that employees are able to access benefits through their employer to be able to get care and treatment for infertility is just a huge, huge win. So it leads to better emotional health, increased engagement, even productivity, and increased loyalty to the company. There are studies that have shown that 61% of employees who received fertility coverage from their employers felt more loyal and committed to their company. They had increased productivity. 88% of women who had infertility care paid for by their employer chose to return after maternity leave, compared to just 50% of the population without these benefits. In addition, the employer can help address DEI goals and commitments to address social determinants of health through providing fertility benefits. They can improve company culture, be known as a family-friendly employer. And in fact, at this point, about 40% of employers are offering some type of family-forming benefit. So pretty soon, it's not going to be, why do you offer? It's going to be, why are you not offering? Because really the culture of this is changing in the workplace. Fertility benefits at one point might have been considered more of a luxury are now becoming more of a necessity and actually a key factor in increasing talent retention and recruitment. There was a study that showed that 70% of millennials said that they would change their jobs entirely in order to receive fertility benefits. So this is a really important factor for the workers.
So you started to touch on kind of what my last question is, and that is what has changed, specifically with employees, that make family forming benefits more important to them. And I'd love both of your thoughts on this.
Well, I think a lot of things have changed, and I think that's why there's so many tailwinds that are helping people recognize how important these benefits are. It really started, I think, several years ago with an increased attention to gender inequity in the workplace and how women were not, receiving equivalent benefits and attention to their reproductive issues. This started largely around single women and freezing eggs and people in the workforce. And very close after that, we had some very disturbing issues in our society around racial and gender inequities that were very, very obvious. And people really began to recognize the social determinants of health that create so many barriers to people in many different communities to access quality health care generally, and certainly reproductive care was well up the list of types of health care people couldn't access for many marginalized communities. And I think this really woke people up to this problem. The pandemic then came along, and we saw how important families were because we were spending all our time with them. And then after that, coming back to work, a whole different concepts around work-life balance. New generations have different perspectives on that. And as Eliza has just pointed out, as a total fertility rate that continues to go down, a talent retention and recruitment, which is critical for companies, the biggest asset they have is their people, and talent retention and recruitment is not going to go away as probably the top issue that employers have to deal with. And family forming benefits are a fabulous way to really help address, that important economic issue for employers. So I think there have been many, many things that have happened, and I'm sure Eliza has some perspectives on that too. Dr. Chin.
Yeah, those are really great points. And I think for better or for worse, the pandemic really helped uncover a lot of things that hadn't been spoken about before. I know within healthcare, we're talking more and more about, physician burnout and mental health. I think mental health is something we're talking, even globally. And especially if you look at workforce well-being, well, these are some of the issues that play into worker well-being. And I think there's more of a need to pay attention to other issues that will affect worker well-being and mental health. And these are some of those issues. And I think for employers to create and foster wonderful working environments, it'll also be important to address some of these issues, especially as we have different generations coming through with different priorities and who will actually change jobs based on ability to access some of these benefits.
Well, thank you both. Thank you for sharing your knowledge, Dr. Adamson. Thank you for the work that you do, not only through ARC Fertility, but certainly also through World Health Organization and a whole host of other entities. Dr. Chin, thank you for being candid about the crossroads that AMWA found itself in, not only as employees, but also providers, and the work that your organization does to combat and protect the workforce as it relates to infertility. So thank you both. Thank you for the wonderful information you shared for employers to consider, especially as we're thinking about plan design for 2025. As Dr. Chin said, there will become a time where it's not a matter of do you offer family forming benefits, but why don't you offer family forming benefits? We're certainly seeing that play out. So thank you both, and thank you to our audience for tuning in to another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.